Hello and welcome. So today I thought we'd talk about dyspepsia. Now, what's dyspepsia? Basically, it means indigestion, which could be from many reasons. A good way of looking at it is really dividing it into two. One is functional and the other secondary to an organic disorder. What do we mean by functional? Functional is really when you can't put your finger on it in terms of a disease. A lot of times this is due to disorder of motility, or it could be, again, from an imbalance of this gastric acid with in regards to dyspepsia and the stomach. But it's when you don't really have a disorder with a name, and so you call it functional. The other is organic, and organic, there are several causes. One is what we call acid pepsin disease. And what that is a irregularity between the acid in the stomach and the stomach itself, the gastric wall, where you get some sort of an inflammatory process. The other is an organic disorder. An organic disorder is where you have some form of pathology that you have diagnosed and which you can hopefully treat. Now, I just want to talk a little bit about what the symptoms are. When we talk about dyspepsia, and we mean indigestion, it could mean early satiety, where you feel full. It's a discomfort after you eat. You can have heartburn. You can have reflux. That's when the acid goes up into your esophagus and causes heartburn, could cause a number of things. Actually, that's one topic in its own, because reflux can do anything from sore throat to dental caries to disruption of the esophageal wall, and you can have pain. So when we talk about dyspepsia, we're really talking about all of these things. And when we talk about when we talk about organic disorders, what comes to mind is, well, there's acid pepsin disease. What is acid pepsin disease? It's when the acid in the stomach and the gastric wall, or the esophageal or the duodenal wall, there's some sort of a disruption and you get injury. The stomach is an incredible organ. It secretes all this acid so you can digest your food, but it has a protective layer on top of it to protect itself against this acid. So when you have a disruption in this, then you start, or you can have injury. And one form of injury is what we call a gastritis or a duodenitis. That's a more diffuse process, and you have a diffuse type of mucosal injury. And then there's ulcers. Ulcers when you have one area or a few areas of more of deeper injury. One important element in acid pepsin disease is a bacteria which we call Helicobacter pylori. Now, this was discovered about 30 years ago. Very important. Important in that about 95% of duodenal ulcers will have this bacteria, and about 50% of gastric ulcers will have it. And if you treat just the ulcer or the gastritis, there's a good chance that it'll heal, but there's almost 100% chance that it'll come back because you haven't treated the bacteria. So you need to give an antibiotic type of therapy against this bacteria. And this is somewhat intensive in that for 2 weeks, you need to take 2 antibiotics and another medication to decrease the acid in your stomach, and we give one other medication to support these. So it's a 2-week, more intensive treatment. After we give treatment for it, after a few months, usually about 3 months, you can check to see if that bacteria is still there by doing a stool test or a breath test. But the success rate is quite high, anywhere from 80 to 90% chance that you will eradicate that bacteria. Aside from that, you can have acid pepsin disease without the bacteria, obviously. Another culprit is NSAIDs, or non-steroidal anti-inflammatory medication. Now, when are these used? These are used in arthritis, rheumatic, and for joint pain because they decrease the inflammation. They're also used as blood thinners, in like where you have a heart disease or for other indications. So alongside the beneficial effects of both anti-inflammatory and thinning the blood and so forth, sometimes it can have other non-wanted effects, and these include gastritis and ulcers in the stomach. And how does it do this? Well, it inhibits what we call prostaglandin, which is a substance that the stomach needs in the secretion to protect itself. So that's another factor that can be involved in dyspepsia. And you can have a whole host of other things as well. Obviously, you want to make sure there's no tumor. And aside from this, there are other facts which I won't really, which maybe we'll get into some other time. Now, what do you do for diagnosis? Well, there's two ways that you can tackle this. One is, if the patient is relatively young, and even if not really, if they have classical symptoms of dyspepsia, you can give treatment and see what happens over the next 2 to 3 weeks. And if everything goes away, that's fine. If not, then you'll do investigation. Or you can do investigation right away. There's two schools of thought in this. Investigation would include, if you're suspicious about anything, like if the patient looks pale or whatever, obviously you want to do some blood tests. You can do a stool test for this, what we call Helicobacter pylori, or a breath test. But the most definitive test is a gastroscopy. And that's where, with a light, we take a look inside your esophagus and your stomach. You sedate the patient intravenously. So it's not a general anesthesia, but you don't feel anything. It doesn't take long, 5 to 10 minutes. And you get to see the entire esophagus, the stomach, the duodenum. And you can take biopsies. So not only do you make diagnosis, but you also take small specimens where you can look under the microscope. And another factor in that is that even if everything looks normal, on the biopsy, sometimes you can come up with really different and important issues that can be treated. Just for medication, we should point out that whether it's a functional disorder or an organic, lifestyle, the food that you eat are all important. So, and also your habits. So, if you're eating late at night just before going to bed, if you're eating a lot of fatty or processed foods, these can really aggravate your symptoms or even be the cause of it. Furthermore, bad habits, too much alcohol, and cigarette smoking. These are all factors that aggravate whatever is there, and sometimes are actually the primary culprits. So lifestyle changes and getting rid of bad habits. And then we move on to medication. Treatment-wise, there's a whole host of medications that we can use. There are medications that decrease the acid in your stomach. If it's a motility disorder, you can give treatment for that. If it's a bacteria, you give treatment for that. If it's something more serious, sometimes surgery may be needed. So it all depends on what the symptoms are, what the findings are. And that's basically what I had to say about dyspepsia. Maybe sometime we can go deeper into this, and hope to see you all later. Thank you.